Well, Dr. Carlson, thank you so much for taking the time to talk to our audience about Lyme disease and tick-borne disease and other chronic illness. Our audience are probably not very familiar with this type of tick-borne disease and Lyme disease. And would you take a few minutes to explain to them what is Lyme disease?
Well, thank you very much, Dr. Young, for inviting me and having me on your show. Most people think of Lyme disease as an infection caused by the bacteria, which is a spirochete, a type of very complex bacteria called Borrelia burgdorferi. That's the scientific name of it. So they think of it as just that infection with that one particular bacteria. But actually, those of us that treat Lyme disease, and especially myself, we define Lyme disease as a constellation of multiple infectious agents that are generally vector-borne, meaning they come from the bites of blood-sucking insects, mainly ticks, although there are other modes of transmission. So patients I have found in my 20 years of treating Lyme disease really usually have 3 to 5 different infections that have come from these blood-sucking insects. So there are the Borrelia species, there are Babesia species. Babesia is a small unicellular parasite, which is a malaria-like organism, which comes from ticks. And there are a couple different species in North America. Then Bartonella is a bacteria that is found in ticks. It also is found in other animals. We'll talk about that later. There is human monocytic Ehrlichia, which Ehrlichia is a small bacteria that lives inside of cells. And the reason it's called human monocytic Ehrlichia is because it preferentially infects a type of white blood cell called the monocyte. And then there's also human granulocytic anaplasmosis. Anaplasma is another small bacteria that likes to infect human granulocytes, a different kind of white blood cell. There are relapsing fever Borrelias, which is a whole different class of the spirochete, the Borrelia burgdorferi, and other species of Borrelia that are in ticks. There's something called Q fever, which is another bacteria. There's Rocky Mountain spotted fever, which is not isolated to the Rocky Mountains, but is all over the country. There's another bacteria called tularemia, which was first known in medicine as a disease that people would get from skinning rabbits. It was transmitted from rabbits to human. And there are viruses in ticks. There are all kinds of things like nematodes, which are small little parasites. So there are all kinds of infections, agents in ticks. I always used to say in my lectures that, ticks are cesspools of disease because they have a tremendous number of infectious microorganisms in their gastrointestinal tracts. So that to me is what Lyme disease is. Lyme disease is a polymicrobial, or meaning many different kinds of infectious agents causing an illness. I found that in my practice, 80% of my patients are co-infected with more than one infection. As I said, the average is anywhere from 3 to 5. The co-infections, unfortunately, are really best diagnosed clinically. And people who are co-infected with multiple organisms are sicker. They're more likely to have failed treatment in the past. They require longer treatment with multiple agents to try to help them. And the co-infections really have to be eradicated if you really want to get rid of the Borrelia, which most people think of as Lyme disease.
Wow, that sounds very, very complicated. So how common this Lyme disease or the co-infections of Lyme disease in the country and in the world?
I think it's actually quite common, especially in the northeast of Pennsylvania and northeastern of the United States, not just Pennsylvania. It's really all of Pennsylvania. I'm in the southeastern Pennsylvania, part of Pennsylvania. But in areas where there are ticks, there are a large, not all ticks are infected, but a large percentage are. One thing that's happened in our environment is that in 1900, there were hardly any deer. There were very few deer, and the deer population has gone up exponentially. And deer's populations have increased in suburbia, where there's no hunting pressure. So we have a tremendous number of deer, and with the deer come deer ticks. And then with the sort of habitat in suburbia, you have some of the other small animals that will transmit some of the other tick species. So I think that It's quite common, especially in areas where there are a lot of deer and therefore a lot of ticks. And that's really in, large areas of Europe, Asia, North America. And then there are different tick species in different parts of the world. There are different tick species in Europe than there are in the United States. And then there are ticks in South America, of course. So anywhere where there are blood-sucking insects, some of these infections can be problematic. I can't give you an absolute percentage because no one's ever done that study and taken blood from 1,000 people at random on the street to see whether they have antibodies to any of these infections or not. I don't think it's ever been done.
So how do people know they are infected in the first place?
Well, let's talk about how these infections are spread and how they infect people, and then what the symptoms are like. That's how people will get an understanding. Most of these infections, again, generally come from tick bites, as the infectious agents are inside the ticks. Well, how does a tick bite? What is a tick bite? Well, the tick has these long serrated mouth parts that as it crawls and gets onto you, it then finds a spot and it digs into the skin. It also releases chemicals from its saliva that numb you so you don't feel it, give anti-inflammatories off, which reduces the host's immune system in the area to the foreign thing that's come in. And it also, they secrete things that will make your blood less likely to clot so that they can actually have blood and drink blood. Then they also secrete a cement-like substance in this area where they bite that acts like a cement plug to hold the mouth parts into the skin. So it's difficult to pull them off. Anyone who's pulled a tick off knows that you have to be careful and slow with steady pressure in order to have that head and the mouth parts and the plug come out. Otherwise, you could rip the head off and leave the parts inside, which isn't a good idea. So once they create that plug, then they start sucking blood. And while they're sucking blood, they like to vomit their gut contents into the wound. That's how they then transmit the infectious agents into the host.
Wow.
There are a few of the agents that can be in the saliva. So in the salivary glands, they can, give them to the host as they're putting saliva in. But generally, they vomit their gut contents into the wound. So that's how the ticks bite, hold on, suck blood, and transmit infections. Now, it is possible that there are other biting or blood-sucking insects that also transmit some of these infections, such as mosquitoes and fleas. Fleas have been known to transmit Bartonella, a bacteria. Mosquitoes, of course, are known in many parts of the tropical world to transmit malaria. But I have had patients tell me that a rash characteristic of Borrelia infection, which we'll talk about, actually came at the site of a mosquito bite. So there are other vectors. Now, unfortunately, there's also sexual transmission of Borrelia. That's been documented. And there has also been documented transmission of several of these infections from the mother to the child as the child grows in utero or inside the uterus. And Borrelia has also been found in semen, and it's also been found in breast milk. So there may be other ways of transmission that are significant in the population, but that aren't generally accepted. Bartonella, another bacteria, as I talked about, at one time in a study in ticks in New Jersey, more ticks had Bartonella in them than did the Borrelia. So it's actually quite common from tick bites, but it can also be acquired from exposure to the saliva or bodily fluids or being scratched by many different animals, such as cats, guinea pigs, horses, dogs, ferrets. A lot of veterinarians have, Bartonella infection. So that's how you get these things and how they can spread to people. So what are the onset of the symptoms like? Well, you can get sick very quickly after a tick bite, or you can take any, weeks or months to develop an illness after a tick bite. It depends upon what infectious agents you got. And there may or may not be what's called an EM rash, erythema migrans. Erythema means red. A red rash. And then the migrans mean that it moves, because the EM rashes from tick bites tend to start one size and they get bigger and bigger and bigger and bigger. They also do not have to have the classic bullseye where the center clears. They can be highly variable in appearance. And I've had patients who had gone to the doctor with a rash after a tick bite and said, I think I had Lyme disease. And the doctor said, no, it's not a bullseye. Well, it doesn't have to be an actual real bullseye. So the presence of that EM rash is enough to make a diagnosis of Borrelia infection, because that is Borrelia in the tissue spreading. Okay. So that spreading rash represents the growth and the spread of that particular organism. If the spirochete, then the bacteria, the Lyme bacteria, enters the lymphatic system or the bloodstream, then it can spread throughout the entire body and infect any organ or tissue. Sometimes after a tick bite, you'll get more of a sort of a crater or an ulcer with a lot of redness around it. That is often an Ehrlichia or an anaplasma infection. Unfortunately, less than half the people who have documented Lyme disease even remember a tick bite, and even less than the percentage of the ones that actually remember a tick bite ever saw an EM rash. So you can't say, well, I didn't have Lyme disease because I never got an EM rash. Well, that's just not accurate. Now, if you have a tick bite, maybe you didn't see it. A lot of people don't see the tick bite because, as I said, they inject these substances that numb you and reduce inflammation in the area. So sometimes you don't even know you had a bite. If the organisms that are coming out of the tick get into your body and bloodstream and lymphatic system, you normally get something that looks like a flu-like illness. You can get fever, headache, stiff neck, muscle aches and pains. You can be confused mentally. You can have joint pain, stomach pain, fatigue, night sweats. Those are characteristic initial symptoms of a first infection. That flu-like illness can be short-lived, a couple hours, or can last several days, and it usually disappears spontaneously. So some people think they just got a summer cold or a summer flu or even a winter flu. Ticks can be active almost year-round. If they're out in the sun, even 28-degree weather, if they're in direct sunlight, they can become mobile. So just because it's cold and it's November or it's February, if it ever gets above freezing and in the sunshine, you still have risk for tick bites. If Lyme is not suspected, because you think it's just a summer cold or a flu, then the infection spreads deeper into the body. It sort of sinks into the body and can go deep into the organs, into the tissues, and become very chronic. So the kind of symptoms that you see once the disease has become deep in the body, penetrated into the organs and tissues, into the nervous system, you can still have intermittent flu-like illnesses, fatigue. Often the fatigue can be overwhelming and unrelieved by resting. You can have cyclical fevers, or fevers come off and on, headaches, Bell's palsy, or weakness of half the face with the face drooping, is also characteristic of Lyme. You can have all of a sudden frequent infections all the time. Say you got Lyme disease in the fall, you didn't really realize it, you thought you just had a cold, and then that winter you get bronchitis, you get ear infections, you get throat infections, you get bladder infections. All these different infections come that normally you wouldn't have. That's because Lyme suppresses the immune system. Another symptom can be swollen glands that come and go in the armpit or the neck, sometimes in the groin. That's more like Bartonella. You can have recurrent sore throats, all kinds of shortness of breath, dry cough, chest pains. New onset atrial fibrillation, which is an irregular heartbeat, often is, especially in a young person, can be the presenting symptom of Lyme. People have stomach pains of all kinds. They have changes in their appetite, irritable bowel-like symptoms. They have change in how they stool or how they move their bowels can change. They can all of a sudden have diarrhea, or they can become constipated. They can have joint pains. Typical of Borrelia is joint pains that come and go. They're migratory. One day it's your shoulder, the next day it's your elbow, the next day it's your knee. They're intermittent and migratory. So they come and go and they change position. That kind of joint pain is very typical for Lyme. Also, people have arthritis. You get moving, motion is lotion. Their joints get better and better as they move if they just have arthritis. But a Lyme joint will start to hurt more and more and more the more you use it. People can have deep bone pain, muscle aches and pains, have muscle spasms. They can have twitches of little muscles where the little muscle kind of just goes on by itself. They can have trouble with their bladder where they feel like they have to go to the bathroom all the time. We call it urgency, frequency. And then they can have pain, and they can even lose their, wet their pants or become incontinent. when you examine these people, they can have all kinds of different rashes that come and go. They can have new onset neurological and or psychiatric symptoms. And that's a very big thing. And I would like to touch on that a little later. All kinds of sleep disturbances. When the central nervous system is irritated and infected, you just don't sleep well. Then a lot of people can't exercise anymore. Say they used to be able to run or bike, and now they just can't exercise. They have what we call reduced aerobic exercise tolerance. They can't tolerate exercise. When they exercise, they feel horrible. They feel sick. Sometimes they get real dark circles under their eyes, and it's not just like allergy shiners, but they're actually, because of the effects on their body. And you as a Chinese medicine doctor would understand the implications of that better than me. Often these people have dramatically increased allergies and also chemical sensitivities. For instance, they can't stand perfume fragrances they used to enjoy, or they have much worse seasonal allergies. So those are the kinds of chronic symptoms that people can have. I probably missed multiple ones, but those are the ones that sort of came to me right away. And it's very important to remember that less than half of the people with Lyme disease ever remember a tick bite, and even less remember an EM rash. And again, the EM rashes are really highly variable in appearance.
Yeah, well, sounds like when you become chronically ill with Lyme or tick-borne disease, it's almost impossible to diagnose them because they mimic so many different kinds of illness diseases, right? So what has been your patient's experience with chronic Lyme disease when they visit different specialists, that didn't remember the tick bite or didn't have a rash that typically would have? What happens to them?
Well, they usually are told that they have chronic fatigue, they have fibromyalgia, or they have multiple sclerosis, or they have Parkinson's disease, or they have dementia, or they have some sort of allergic problem, or some sort of chronic skin condition. They're told they're psychiatrically ill. So many of these things happen. And patients that I see that have been really sick for a long time, sometimes they've been to see anywhere from 10 to 30 doctors, and not one of them has diagnosed it properly. So one of the reasons is that, blood testing is really unreliable in this illness because the antibody production against pieces of the bacteria are really highly variable. When people have an initial illness and they think it could be Lyme, often they go to the doctors draw a blood test for antibodies right away and say, oh, well, it's negative, so you don't have Lyme. But that's not accurate because it takes several weeks to develop the antibodies. So if you have a new infection, you may have no antibodies at all. It may take 6 weeks or so. So by that time, the infection spread throughout your whole body. So it's important to treat it early. So a positive test, if you have antibodies, is helpful because that shows that the body has indeed seen this organism, has made antibodies against it. But a negative test should never, ever be used to say you do not have Lyme disease. So negative test does not rule out the presence of the illness. It's a clinical diagnosis, and it's made by a doctor who takes an adequate and accurate history and does a comprehensive physical examination. Because if you take a good history and you really take a good look at their body, then you'll be able to understand what the problem is.
I can understand that the antibody may not develop in the acute stage of illness. What happens to those people who have chronic symptoms and do not have antibodies? Is that still possible they have Lyme disease?
Yes. The reason is that Borrelia burgdorferi, the organism that we talk about as Lyme disease, although, of course, there are many other co-infections as well, is an incredibly sophisticated organism that is really good at evading immune system detection. And it also is very good at hiding and confusing our immune system. It short circuits part of our immune system. And it is very good at, sequestering itself in biofilms and stopping the immune system from actually attacking it. So often the sickest people don't have any antibody production until you start to treat them and you try to help them and you start to build up their vitality. And then sometimes you'll see antibodies all of a sudden light up like a Christmas tree. But some of the very sickest chronic Lyme patients don't make any antibody because of the way the organism affects and damages our own immune system function.